Hi, my name is Dawn Richards. I'm a person who lives with rheumatoid arthritis. I'm the Vice President of the Canadian Arthritis Patient Alliance, and I work for myself as a consultant. A big part of my everyday life is being an advocate for patients, either myself or other patients who don't have the means or resources. But I think outside of those traditional connotations of advocacy, you can implement it in your everyday life. It's about asking questions when you don't understand something. It's about understanding, at the pharmacy why you've been given instructions to do something. And it's simply about understanding your role and responsibilities and things. And it doesn't have to have the negative connotations, I think, that are traditionally associated with advocacy. There's a couple of ways that pharmacists can be better advocates. One is advocating on your patient's behalf. And whether that's simply letting them understand that you know what they're going through, that you have knowledge that can help them, and helping impart to them that if they either take better care of themselves or take a bigger responsibility in their care with you, they're going to do better overall. So I think that's one way. I think another way is more the traditional role of advocacy, and whether that's being involved in pharmacy associations, provincial bodies, understanding what's going on in the big picture of healthcare. I think that's another way to be involved. So they're a little bit different, and there will be different ways that work for different people, but they're both forms of advocacy. I think the other thing for people to understand too in terms of advocacy is that it doesn't have to become a full-time job. It doesn't have to be something you're spending all this extra time on. It can really be part of your everyday, especially in terms of a pharmacist simply helping their patients out and doing what's best for them, and maybe helping them access some resources that they didn't have access to before. I don't think people should think that it's going to take a lot of extra time and be a burden. It can be something that just becomes part of your everyday role.